Hello guys, today I want to discuss about a very common topic of the respiratory system, asthma, and I request you to subscribe my channel for watching my further videos. It will be the contents of our topic. Before I start the main topic, I want to highlight a little bit about large and small airways. The large airways obstruction is very uncommon and may be obstructed by any tumors or infection of the large airways, but smaller airways is very common obstructed by asthma, COPD, bronchiectasis, cystic fibrosis, and so and so. And what is asthma? It is a very common disease of the respiratory system, and it is a chronic inflammation and hyperreactivity of the small airways. It is treatable in early stage, and it is also possible to develop to irreversible stage if kept untreated or poorly controlled over the time. Type of asthma: it is divided into two types, extrinsic and intrinsic. The extrinsic, also known as atopic, is a type 1 hypersensitivity which is associated with IgE antibodies, and intrinsic, which is not associated with IgE antibodies. With the risk factors: family history, genetic, prematurity, low birth weight, obesity, smoking, which is both passive and active, allergens, some drugs. The pathogenesis: when a patient is exposed to any risk factors such as allergens, this will bind to IgE antibody which is present on the surface of the mast cells. These mast cells stimulated and will produce inflammatory mediators such as histamine. They will cause the inflammation and bronchoconstriction, which is finally leads to excessive production of the mucus, and all of these factors will cause the narrowness of the airway and finally the obstruction. The clinical features will be shortness of breath, cough, chest tightness, recurrent wheezing, and hyperinflammation and wheezing also as signs. Investigation: the pulmonary function test, which is we see for force expiratory volume in 1 second to force capacity volume. If it is more than 80%, it is more goes toward the asthma, and if it is less than 80, then it will be less commonly the asthma. So we should seek another cause. Spirometry, skin prick test, methacholine challenge test, rarely and less commonly CBC chest X-ray to exclude the other causes of shortness of breath. The treatment will include the medications and lifestyle modification. The lifestyle modification: weight loss, stop smoking, reduce exposure to allergens, identify and remove the occupational triggers, breathing exercise. But the medication will include the inhaled short-acting beta agonist, most commonly salbutamol is used, inhaled corticosteroids, long-acting beta agonist, and oral corticosteroids. This chart shows the strategy and how to treat an asthmatic patient. In step 1, with intermittent patient, we will use short-acting beta agonist, and it is in form of inhaler. And in step 2, with mild persistent patient, we will add ICS inhaled corticosteroid with low dose along with the short-acting beta agonist. In step 3, which is moderate persistent patient, we will add also LABA, long-acting beta agonist. But in step 4, with severe persistent patient, we increase the dose of inhaler corticosteroid. But in step 5, very severe persistent patient, we also add the oral corticosteroid. What is exacerbation of asthma? Actually, it is a severe attack of asthma which sometimes will attack the patient and with severe symptoms such as shortness of breath, chest tightness, wheezing. In case of severe, its treatment is the OSHT mnemonic for understanding. It is O stand for oxygen. Without delay, oxygen should be attached. S for salbutamol, which is through inhaler or nebulizer. H for hydrocortisone, give IV hydrocortisone. I ipratropium, if severe, add ipratropium bromide. And T for thiophyllene, which is not used commonly. In summary, asthma is a chronic disease. Smooth muscle is in respiratory system causes bronchoconstriction of already narrowed airway. The inflammatory response causes excessive mucus. The medications need to address both inflammation and bronchoconstriction. During acute attack, prioritize the SABA. For prevention of attack, use LABA and glucocorticoid or leukotrienes modifiers. Thank you, friends, and at the end I request you to subscribe my channel for watching further videos. Thank you.